In 1 year, 993 lives have been lost to COVID-19. Here's a look at just some of the faces that we've lost over the past 12 months. So much has happened this year. It has been a historical, gut-wrenching, and exhausting year. And although 1 year later, things are looking better, this morning we're taking a look back at how we got here and the series of events that changed our lives. It was New Year's Eve when Chinese health officials notified the World Health Organization about something peculiar. A patient was showing signs of pneumonia, but the symptoms were different. Something seemed new. A week later, China and the WHO confirmed a new virus belonging to the coronavirus family. 2 days later, on January 9th, a 61-year-old man died from this new virus. Cases increased by the hundreds. It was spreading outside the country. Disneyland in Shanghai shut down. Lunar New Year celebrations were canceled. The fast spread even forced the city of Wuhan, the origin of the virus, to go on lockdown. By the end of January, the White House banned entry to the U.S. by most foreign nationals who had traveled to China. But the novel virus was on the move elsewhere. On January 31st, Russia, Spain, Sweden, and the United Kingdom each announced their first cases of the virus. The same day, the WHO declared a global emergency. As the calendar changed to February, new cases in other countries were confirmed. Australia, Canada, Germany, Japan, and Singapore were just a few. Meantime, new cases were being reported in the U.S., including Los Angeles. On February 5th, the U.S. chartered a plane to evacuate U.S. citizens in Wuhan. 3 days later, the first U.S. citizen died of the virus in Wuhan. On February 11th, the death toll topped 1,000. The same day, the WHO named the new virus COVID-19. The next day, 175 people traveling on the Diamond Princess cruise ship tested positive for coronavirus. The U.S. evacuated the American citizens on board. On February 19th, Iran reported its first case of the virus. Hours later, the country announced 2 people died. 2 days later, Italy reported 2 people died. On February 24th, the U.S. stock market tanked for the first time. The Dow Jones dropping more than 1,000 points. 2 days later, California announced the first case with no clear source of exposure.
This is a fluid situation at this time, and I want to emphasize that the risk to the general public remains low.
It's going to disappear. One day, it's like a miracle. It will disappear.
On February 29th, the U.S. saw its first death to COVID-19. The man was from Washington and in his 50s.
This is probably the tip of the iceberg. There's probably other patients who are getting this disease who are more mildly affected.
On March 6th, Vice President Pence announced 21 people on board the Grand Princess cruise ship off the coast of California tested positive for the coronavirus.
We are stuck in our rooms, but we are able to go out on the balcony.
The cruise ship quickly became a symbol of the virus.
It is our duty to help these people. The friends and families on board this ship.
By March 7th, 100,000 people were infected with coronavirus worldwide. The next day, the U.S. confirmed it had 500 cases.
This is literally a matter of life and death.
And the first cases of COVID-19 were reported in the Central Valley.
We're seeing a lot of action and a lot of fear right now because we're dealing with some unknowns.
On March 11th, the WHO declared COVID-19 as a pandemic, changing the way the world thought about the deadly virus.
We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction.
At this point, 126,000 people worldwide were infected with the virus. 4,600 people died. The virus was spreading faster, especially in the U.S., and extreme measures were being taken.
Say no large crowds, no long trips, and above all, don't get on a cruise ship.
Professional sports were suspending seasons. Disneyland and Universal Studios announced it would shut down for the remainder of the month. Governor Newsom announced statewide recommendations and executive orders that impacted all counties, including Kern, which had no confirmed cases. BC and CSUB announced major changes.
I'd definitely say I'm pretty scared.
Classes were moved to online.
Today we have announced that CSUB will immediately transition to what we are calling alternative delivery of our coursework from this day until the end of the semester.
Over the weekend, long lines formed as people prepared for the worst.
And I'm in line since like 6:20 this morning, hoping to get toilet paper and paper towel.
On Sunday, March 15th, churches across Kern County shut down for service.
And so there will be no masses after today for the next 2 weeks.
Some churches turned to the internet, live streaming their services or posting messages on YouTube.
This may be our new normal for a little while, and we're kind of working through it and seeing how things go.
Later that day, local school districts announced they were closing for nearly a month amid concerns.
It's a minute-by-minute flow of information, and we are responding as quickly as possible.
It is the news we have all been bracing for, and today the Public Health Department confirmed Kern County's first case of COVID-19.
This morning at 4 a.m., we were notified that a non-Kern County resident, while visiting Kern County, has tested positive for COVID-19.
Later that week, Governor Gavin Newsom announced a stay-at-home order.
If we're to be criticized at this moment, let us be criticized for taking this moment seriously.
The next day, an emergency order was issued in Bakersfield.
This is a big deal. We do need to take precautions.
Gyms, bars, and restaurants emptied. Less than 2 weeks later, Kern County lost its first resident to the novel virus.
I'm going to miss her a lot.
Susie Garcia was from Delano. She was one of the first people to contract the virus here in Kern. She died 2 days after receiving her positive test result.
A lot of people in the community think that this is not real. Unfortunately, it hit home for us, and it took one of our loved ones from us.
As cases, hospitalizations, and deaths increase worldwide, health officials were trying to grasp the basics of COVID-19. For weeks, they told us masks were unnecessary for the general population. But on April 3rd, health officials reversed course, saying research indicated masks would slow the spread and save lives.
In light of these studies, the CDC is advising the use of non-medical cloth face covering.
In Kern County, daily cases were minimal, but people were still getting sick and dying.
This changes on a daily basis.
1 month after the first case was confirmed in Kern, 3 people lost their lives.
This is a tragic day.
In late April, 2 local doctors got a lot of heat, claiming Kern County should reopen immediately.
As I shelter in place, my immune system drops. You keep me there for months, it drops more. And now I'm at home, hand washing vigorously, washing the counters, worried about things that are indeed what I need to survive.
I want to just reiterate, we do not agree with the statements that were made.
By the end of April, the virus made its way into local nursing homes.
We are worried.
A majority of the cases and deaths came from one place, Kingston Healthcare Center.
That was the last person we talked to.
These are people. These aren't numbers.
By the beginning of summer, Kern saw its first true surge of cases and deaths.
Our hospitals are struggling with staffing issues. Adventist Bakersfield, Kern Medical, Mercy Downtown, and Mercy Southwest are all at or exceeding their licensed ICU bed capacity.
On the 4th of July, the county surpassed 100 lives lost. By the end of the month, the death toll doubled. But Kern County saw improvement into the fall. More people were getting tested at mobile sites. By mid-October, Kern moved into the red, less restrictive tier.
I know that in the coming days, there will be a storm coming, and I'm so much more than prepared. I am ready.
I'm sorry, I just have to catch my breath a little bit.
By Halloween, cases started to rise once again. It would become the beginning of the biggest and deadliest surge. Cases, hospitalizations, and deaths spiked after Thanksgiving. Hundreds were getting infected every day. Our worst day was on December 9th, 2 weeks after Thanksgiving, when 1,479 people tested positive. As a result, the week before Christmas became the deadliest week. The trend continued through New Year's and beyond.
I watched the news and the number just kept growing and growing. And then that's when I realized, oh my God, this is so serious.
December and January would become the deadliest months of the pandemic. More than 400 people died as a result from the holidays. A way out of the pandemic arrived in Kern County. The first shipments of the COVID-19 vaccines were delivered on December 17th.
I feel very blessed to be the first one who receives the vaccine.
The doses first went to frontline healthcare workers. On January 20th, the Kern County Fairgrounds turned into a mass vaccination site, giving shots to hundreds every day.
I've been waiting for this for a year. We have 8 great-grandchildren, 3 are infants, so now we don't have to be worried about when we visit them.
So that's the year. I mean, it's been a year since that first case, and it's just unbelievable to see where we've been. And but again, the good news is that there is a light at the end of the tunnel. It seems like, and it's getting brighter and brighter every day.